Sure. Hi, my name is Dr. Hassan. I'm a resident in cardiac surgery in the Heart Hospital in Qatar. And today I would like to share a case with all of you that I felt is important to be shared in as it's very rare and very it's important for everyone to know the specifics of the case. So as we all know, aspergillosis is known to be an opportunistic fungus. But I have a case, or we had a case in our hospital where that was not what happened. It didn't act like an opportunistic fungus. So as I begin, I would like to say that we had a 30-year-old male patient who came to the emergency with episodes of right-sided numbness in the body. Because he was suspected to have stroke, we went ahead with the CT head and MRI, which showed focal lesions, about 3.5 millimeters in size in the left parietal region. To further study this, we did a transthoracic echo, which showed a mass in the aortic valve. So to better characterize and to better visualize it, we did transesophageal echo. Transesophageal echo was done, which revealed, along with this mass, thickness in the left atrial wall and the interatrial septum. Along with redemonstration of the highly mobile aortic valve mass. We obviously involved the cardiology team and the infectious disease team to further assess the patient's findings. We did cardiac MRI, which showed a mediastinal mass-like structure that was surrounding the great vessels that were arising from the heart and going all the way to the thoracic inlet. As we can, so I will show you the images now. We have over here, this is the aortic valve, and we can see there's thickening of the aortic valve leaflet, and here we can see the interatrial septum is thick. These are transesophageal images. Then when we basically after 4 days, we repeated the echo, and we can see over here the aortic valve mass had significantly increased in size. If you look at over here, it's still the leaflet looks like a leaflet, but here it looks more like a mass that was attached to the leaflet. And this increase in size was concerning. We did for him the MRI. As we can see in the MRI over here, there is tissue that is surrounding the great vessels. Thickening of the tissue around the vessels, as well as over here. We can see there's this thickened tissue, along with redemonstration of the aortic valve mass that I mentioned earlier. When we did for him the FDG PET CT scan, we found that there was intense uptake in the mediastinal mass-like structure, as we can see over here. So these, for us, were concerning findings. However, we still did not have a clear images, because we were doing for him repeated blood cultures. They were failing to grow any organism, and IgG for the 4 levels we did were very high, about 7,700. Because of this, we consulted the team in rheumatology for suspicion of IgG4 related disease. And for that, they wanted us to do a tissue biopsy. Tissue biopsy was challenging for him, because we initially wanted to do it as through CT guided biopsy, but the CT guided biopsy was not possible, as the interventional radiology team declined to do it due to the high risk. Then the other option was to do mediastinoscopy, surgical biopsy. This was planned, and the night before the procedure, the patient had an attack in which he had bilateral lower limb pain with absent pulses. When we repeated the echo, we found that he had, I'll show you over here. So the repeat echo showed a decrease in size of the mass. So this was the mass before, and then we can see over here, the mass became smaller. So we suspected embolism from the mass. We took him for a femoral exploration, in which we removed large emboli along with large emboli, which consisted of tissue along with thrombus. This was extracted and sent for histopathology. This happened on 2 occasions, and because of this, we could not proceed initially with the mediastinoscopy, because the day before we had the schedule, the procedure plan, he had this attack. The next time we proceed or we planned the procedure, he had a high INR. So because of this, we could not do his surgical biopsy. And so in this very critical condition where the patient was very sick, and we could not proceed with any diagnostic procedure, and because of the fact that he was there was no further improvement or anything. So the patient was started on pulse steroids on suspicion of IgG4-related disease. This therapy initially had short-lived improvement, and then it was followed by rapid deterioration. Once he deteriorated, we contacted the pathology lab to expedite the thrombectomy tissue pathology. And in that they told us that he had invasive aspergillosis that was seen in the samples that were extracted during the embolectomy procedures. As we can see over here, this is the histopathology showing hyphae, and later on they confirmed aspergillosis. After we had confirmed the diagnosis, we started the patient on amphotericin immediately, according to the recommendation from the infectious disease team. But he soon went into septic shock, followed by cardiac arrest, and eventually he did not survive. So this was a very unique case, because normally aspergillosis affects patients who are immunocompromised, invasive aspergillosis. But our patient, he did not have any known immunocompromising condition. He did not have any cardiac pathology. There are some case reports in the literature that mention aortic aspergillosis or aspergillosis of the aortic valve, but none of them have any. That means, all of them have some cardiac pathology. Like one patient had a history of cardiac surgery. One patient that I saw, he was HIV positive. One more patient that I found in the literature, he had prosthetic aortic valve, but our patient, he had no known immunocompromising condition, no underlying cardiac abnormality, no prosthetic valves, which is why this was a very rare case. Because of the low diagnostic suspicion, we did not have we kept on delaying the pathology. We were not able to understand it, but if we can keep this is a possibility, then this will I wanted to share this so that this can be better dealt with, maybe if it happens again.